Hi, my name is Emma Reynolds. This is my COVID-19 case study on comparing Tennessee counties for VA 513 Contemporary Analytics at Western Kentucky University. So a little bit of background on why I chose this. Being from Tennessee, there have been multiple studies done on mask effectiveness, and I've noticed a lot of people, especially in 2020, refusing to wear their masks in public, even whenever my county had a mask mandate in place. And I also decided to use Tennessee because of the local and state government's adverse reaction to the subject of mask wearing. The Tennessee state governor is very against mask mandates and believes they're not really necessary to ward off COVID or remain healthy. And the time frame that I used for this, I used March 2020 to December of 2020 just to solely remove the possibility of vaccination status from that data, considering breakthrough COVID and all of that. And I also utilized January 2021 to now October 2021 for my later questions that are posed. So these are my questions that are posed, and we're going to dig into if there's a relationship between mask mandates and rates of COVID-19 cases in Tennessee, what the relationship between population size and COVID-19 infection rates are, and if there's a relationship between case numbers and vaccination rates in comparison to case numbers in 2020. So for that last one, what we'll be doing is, after analyzing the data from 2020, really looking at that raw data, we're going to take vaccination rates and case numbers from 2021 and compare that with information from the other two questions findings, and we're going to have some information to kind of infer on and get to an overall answer here. So question one, if there's a relationship between mask mandates and rates of COVID-19 cases in Tennessee. So what I wanted to start off with was just a go across the whole map and kind of see where Tennessee stands. And as you can see, Tennessee is right there smack in the middle, on the upper end of kind of the average. So that kind of gave me an idea of where Tennessee stands as of 2020 in December, and where to go from there. So we're going to look at cases by county in Tennessee in 2020. So as you can see, some of these are a lot bigger than others. Shelby County, Davidson County up here up top, Knox County, these are all counties with very, very big cities in them. So Shelby County has Memphis and Davidson County has Nashville. And that could potentially have some sort of impact on these case numbers, because if there's more people that are likely to get sick because there's a large group of people there. So now we're going to look at mask mandates, which is actually very, very interesting to me, because as you can see here, the counties with the highest rates of infection have mask mandates in place. So someone looking at this could think, okay, like just looking at this raw data and not considering any other impact, could think, okay, well then the masks aren't working, or they're making it worse because counties with higher COVID rates have mask mandates and counties with lower rates don't have mask mandates. So we're going to dig into these findings based on this data. And like I just said, the counties with the greatest number of infections had mask mandates in place as of December 2020. But there are factors to consider here. So the top counties, as I said, are homes to very, very large Tennessee cities. And because of that, those counties have higher population sizes because of those cities. And because of that, there's more people there to potentially get infected. And those top counties also, because they're large urban areas with huge cities who are like, they're tourist areas, they have much higher rates of tourism. So people could be coming from out of state, all over the country, all over the world, potentially bringing COVID with them and not realizing it. So my second question here is what the relationship is between the population size and the COVID-19 infection rates. Here we're going to look at we're just going to compare population compared to cases to see if there's any sort of correlation there. As you can see, the higher county populations have the higher case populations, and that is consistent all the way down through here. So there is a positive correlation there, as you can see. And next, we're going to look at the 2020 case numbers versus the 2021 case numbers to kind of give us an idea of what we're looking at with our third question, and see if there's any sort of a difference in the 2021 case numbers and see if there's counties that are different. So as you can see, Shelby County, Davidson County, Knox County all still up here at the top. The purple here is the 2021 cases and the blue is the 2020. And so our findings for this were there is definitely a positive correlation there between population size and COVID-19 case size. But just because there's a correlation does not mean that that's the cause or that is definite, because, correlation does not equal causation. But given the top 15 counties, the ratio between population size and infection rate remained near constant. So as you looked at that dual axis chart, the ratio of blue to yellow, as it waned down to the lower amounts in the lower populations, the ratio between those two colors stayed about the same. So factors to consider, though, while we were looking at that 2021 versus 2020 case count, the main factor to consider here is that there are higher COVID-19 counts in 2021 as opposed to 2020, despite having vaccines available and large groups of people going and getting vaccinated and mask mandates being lifted in these counties. And it's very, very interesting. So we're going to jump into question 3. If there's a relationship between case numbers and vaccination rates in 2021 compared to the case numbers in 2020. So what we're looking at right here is vaccination numbers compared to case numbers in 2021. And as you can see here, it's still pretty constant all the way down, still a pretty positive correlation there. And very interesting, though, because as you can see, there's a little bit of population discrepancy here, but it all remains about the same ratio wise. So, and the big one that we're going to look at is if the case numbers have changed in comparison to those vaccination rates. So what we're looking at here is fully vaccinated people in each county. So this is a massive amount right here compared to down here, and compared to these case numbers. But the thing is too, is that despite all of these people getting vaccinated, this is still a higher number for 2021 than it is for 2020. So, and like I said, there's a little bit of a discrepancy, a little bit of inconsistency with, as it's different counties, different groups of people, you're going to see dips in fully vaccinated, like Montgomery County here, and Davidson County right here. So, with our findings for this, for question 3, if there's a relationship between case numbers and vaccination rates in 2021, COVID-19 infections are higher in 2021 than they were in 2020, despite the fact that there was a lack of a COVID vaccine in 2020, and there was an implementation of mask mandates in 2020. So we'll go into some inferences in a minute with that information, but our overall findings, there was no direct relationship based on that data, that mask mandates and rates of COVID-19 cases in Tennessee were correlated, they were correlated. So mask mandates did not appear to have an impact based on that chart, but there are other factors to consider and other things that could have an impact. So population size, location, whether it's an urban or rural area, how many people are, the population density, factors such as that. There was a positive correlation between COVID-19 infection rates and population size. Higher populations correlate with higher rates of infection. Obviously, there are groups there that don't fall into that category. So there will be higher populations with lower rates of infection as opposed to a lower population with a higher rate of infection. So just because something correlates does not mean that it is true fact. And if there is a relationship between case numbers and vaccination rates in 2021 compared to case numbers in 2020. So the increase in case numbers over the course of the 2 years, and there were higher rates of COVID-19 infection in 2021 by county than in 2020. So based on those findings, we can infer some things, right? We can infer that COVID-19 case numbers were objectively lower in 2021. That's not even an inference, that's a finding. But using that information, we can infer that vaccine availability and lifted mask mandates with large groups receiving the vaccine resulted in mask mandated counties in Tennessee having lower case numbers due to mask requirements. So basically, let me dive into this a little bit. The mask mandated counties in Tennessee having lower case numbers due to the mask requirements is based off of the idea that COVID case numbers were objectively lower in 2020 as opposed to 2021, whenever everyone's going out and getting the vaccine and they're doing these vaccine lotteries and everyone's going and getting vaccinated, but people are still catching COVID and breakthrough COVID is still happening with the Delta variant. So if mask mandates were put back in place, I should say, then it is a possibility that case numbers would begin to dip back down again due to the vaccine and the mask in conjunction with each other. So here's my references. Thank you so much for listening. I really appreciate it. Thank you.